Thank you for watching this video. Our goal with this video is to give information on the risks and benefits of wisdom teeth removal. Wisdom teeth are located in the upper and lower jaw and are the last tooth. Also known as third molars, these teeth come in and erupt in the furthest back part of our upper and lower jaws. Typically, these teeth begin to come into the mouth between 16 and 20 years of age, with an average being 18 years of age. These teeth typically cannot be brought into the normal position and are crowded out by limited jaw size and become impacted. Impacted means that teeth are unable to come into their normal, erupted position. These teeth are angled forward and typically lean into the tooth in front or are angled backwards and are readily spotted on a typical radiograph. These teeth require removal in order to avoid damage to the adjacent teeth because of bone loss or gum disease and the possibility of cavities developing that not only damage the wisdom tooth but also the tooth in front of it. In addition, wisdom teeth that are not removed can develop cysts and tumors and can require additional treatment. It is possible for the front teeth to shift or cross due to the forced eruption of the wisdom teeth, requiring braces to move the teeth back. The evaluation of a patient includes inspection of the mouth, the jaws, the jaw joints, the teeth, and the bite, along with pictures and radiographs to see what the situation looks like and if the wisdom teeth require removal. Sometimes it is okay to keep the wisdom teeth with only small risks of future trouble. However, many times it requires removal of these teeth to avoid pain and infection, among other issues. The procedure for removing wisdom teeth involves making an incision in the area of the wisdom tooth, and the gums are gently pushed back. If necessary, a small layer of bone is removed, and the tooth is exposed and oftentimes cut into several pieces, which allows the careful extraction of these teeth. After removal of the wisdom teeth, stitches are typically placed. If these stitches are dissolvable, they do not require removal at a future appointment. Gauze is then placed over the surgical site to help control oozing. The risks of removal of wisdom teeth include damage to the adjacent teeth or other teeth with injury or loss of fillings or crowns. In addition, bruising or injury or damage to the nerve in the lower jaw may lead to a painful nerve condition, numbness, tingling or loss of feeling of the lower lip, chin, cheeks, gums, teeth, and tongue that may last days, months, or maybe forever and may be permanent. Bone chips or spicules can occur within days or weeks after the extraction of wisdom teeth. These things do not have a long-term negative effect on healing. A dry socket is a painful condition that can occur typically 3 to 5 days after the removal of wisdom teeth and leaves exposed bone, which results in deep, intense jaw pain. Healing will be slower after this occurrence, yet treatment is available and may include multiple visits with your surgeon. The sinuses may be exposed with removal of the upper wisdom teeth, leaving a small hole or communication that may require closure, additional treatment, and different post-operative medications depending on the situation. Infections can occur which typically respond to antibiotics and do not usually require additional surgical care. Irrigation or exploration of the area may be necessary, and other treatment which can be severe, which may require hospitalization, drainage, and IV antibiotics may be required. Another possible issue that can occur with the removal of wisdom teeth is a broken jaw. The jaw can break either during the procedure or after the procedure. To prevent this from occurring, soft foods are recommended during the healing period to help minimize the risk. Treatment options include either surgically removing the teeth or not and leaving the teeth in place. Leaving the teeth in place does leave you at a risk of developing infection, pain, swelling, and the shifting of teeth as a possibility. The timing of removal of wisdom teeth can typically be scheduled when it is convenient if no symptoms, pain, or infection are present. It is usually done with IV sedation, although some situations will allow the use of local anesthetic alone. IV sedation is when we give medicine through the IV line to help a person relax with little or no memory to the procedure. Local anesthetic is also given, so when you wake up, you will be comfortable. Most people will take 4 to 5 days off of their normal schedule to allow for recovery and return to full activity. Each situation is different, and each person reacts differently to these procedures, and variations are common. Complications of IV sedation include nausea and vomiting, lightheadedness, dizziness, allergic reaction, IV site and vein irritation, and sometimes, in rare situations, can possibly be fatal. When medicine is given that allows for sedation or general anesthesia and makes you sleepy or completely asleep, the patient must not have anything to eat or drink for 8 hours prior to the surgery. Generally, this means nothing to eat or drink after midnight, including no water, liquids, or solid food, with the exception of some medications that your doctor will clarify with just a sip of water. Nausea and vomiting can occur with any type of anesthesia, and this is not only messy but dangerous, and aspiration or getting food or water in the lungs can be life-threatening. The patient may not drive home and needs an escort to drive them home. The effects of anesthesia can last up to 24 hours, so the patient should not operate machinery or drive for the first 24 hours after surgery. After the surgical procedure, when anesthetic is used, the patient is allowed to wake up to a point of being able to leave in a safe and predictable fashion. Instructions will be given in a written format and reviewed to ensure understanding and that your escort is comfortable with the instructions. You may be given a follow-up appointment when necessary. Typical things occur after this type of surgery and include things like pain and tenderness, bleeding off and on for the first 24 hours after surgery or longer if you take blood thinners, swelling around the mouth and face, and sometimes under the eyes, bruising of the lips, cheeks, sides of the jaw and neck, and sometimes under the eyes and neck, jaw muscle stiffness and limited mouth opening that lasts for up to 1 week. Soreness or cracking at the corners of the mouth and lips can also occur. To help with these things, ice packs should be used for 20 minutes off and on for the first 24 to 36 hours. After this time, ice will slow down resolution of the swelling and is no longer helpful. Pain medication is prescribed and gauze is given to help with the bleeding. Please feel free to call with any questions or concerns, especially if you are worried or concerned in any manner. The next step in this process is for your surgeon to discuss the risks and the benefits of these procedures and to review your X-ray in detail. You will be asked to sign a consent form to confirm your understanding of the procedure. Insurance questions and financial questions will be answered as well. This video was designed to be informative to highlight the risks and the benefits of wisdom tooth surgery. Please feel free to go back and watch this video again and ask questions until you feel completely comfortable and clear about your wisdom teeth. We are committed to your safety and well-being and in making this experience as comfortable as possible.